Kate Brown says she has directed the Oregon Health Authority to release more information about positive COVID-19 cases.
People in communities across the state have asked for more details on patients so that they can best protect themselves and their families. Fox 12's Brenna Kelly joins us live in studio now with the update and the very latest. Brenna.
Well, the obvious problem OHA has here is not releasing too much information so they don't compromise patient privacy. Here's how they'll be changing their reporting. Age ranges will now be by decade for all positive cases. Previously, there were larger ranges. Hospitalization status will be included for all positive cases if known, and the number of available hospital and ICU beds and ventilators will be provided. The governor said as of today, Oregon has 2,028 available hospital beds, 394 available ICU beds, and 608 ventilators. For reference, Oregon has around 6,000 beds total. Washington State has 13,000. Brown explained why Oregon has fewer beds compared to other states around the country. She said it's because Oregon has been efficient in delivering primary care. She explained the state's joint task force is using modeling data to make sure Oregon can utilize makeshift hospitals like the one at the Salem Fairgrounds. Meanwhile, the governor says they're ramping up testing capacity in response to the coronavirus pandemic. The state lab received 4,000 swabs from the Department of Health and Human Services yesterday. As of today, the governor says both Legacy Health and Kaiser Permanente are processing tests in-house.
We know roughly that of the COVID-19 folks who are positive, roughly, these are very rough numbers, about 20% of those require hospitalization, and about a quarter of those require a higher level of intensive care. So for me, what's going to be driving this is our ability to provide the appropriate level of hospital beds and, frankly, both doctors, nurses, and medical personnel to staff those beds.
You've heard the term flatten the curve, but just when will we know when we've reached the top so we can begin our descent from this virus? The governor says she's watching the modeling data closely for any evidence of this. That information, she says, will be available tomorrow. And for now, the governor says the more we isolate, the better chance we have of not overwhelming hospitals and healthcare workers. Reporting live in studio, Brenna Kelly, Fox 12 Oregon.